614225. Last one, 614225. I'm shaking it up. All right, next number, 614592. 614592. Going once, going twice. Next ticket, 614032. 614032. One more, we have to have one last draw of the ticket. I'll be back, don't worry. You're welcome. 614443. 614443. All right, well, we're gonna start the next session. The prizes are not going anywhere. We have more tickets in the basket. I'll be back. I'm shaking it, I'm shaking it. Hold on, all right, let me put my hand in it, okay. Is there anything else I gotta do, ladies? Okay, let me pick one more number. Swirl it, sir. Okay, let me swirl it. Okay, let me shake it up. All right, one more number. Okay, one more number. 614366. Hello, 614366. Amen. You see, little ingenuity. We got a winner. Come on down, beautiful. 614366. Thank you.
All righty. Well, before we bring up our other host, we have one more panel. We have the very talented Malik Yoba that's going to be joining you shortly. So make sure you guys stay put because you guys are in for a treat. The next panel is about sickle cell. Sickle cell disease, health, quality of life, and cost. Why sickle cell matters. For our next session, inequities in sickle cell disease, health, quality of life, cost, why does it matter? With us today we have Mr. Travis Stevens, who has extensive leadership and experience in the pharmaceutical industry. He has expertise in oncology, hematology, nephrology, pain, women's health, psychiatry, urology, rheumatology, neurology, and immunology. Sorry, a lot of big words, okay? Anyway, with a recent focus on rare and ultra-rare diseases, Travis's experience with several firms, excluding Vertex Pharmaceuticals, includes regional sales director positions, leading national sales leadership teams, strategic account leadership, medical science liaison, strategic account leadership, again, patient engagement managers and marketing operations and U.S. marketing directors. Please welcome, everyone, Travis Stevens to the stage. Hi, welcome. I hope I didn't mess up those words too much. Welcome, thank you so much.
How many people have noticed there's more information about sickle cell disease in the news recently? Show of hands. The reason for that is because there's been more breakthroughs in the last 12 months than there were in the preceding 20 years. As Ms. Bailey said, my name is Travis Stevens. I work in the pharmaceutical industry. I'm not going to be before you long, but I am going to talk a little bit about sickle cell disease. I'm not going to talk specifically about the new treatment options, but I am going to give you some tools and resources. So let's jump right into it. I lead a team at Vertex Pharmaceuticals called the Patient Educator Team. You don't want to hear about me, but just know I do work for Vertex. We're going to talk about 6 really important things. Vertex, sickle cell disease, the causes of sickle cell disease, symptoms and the impact of the disease community. We've heard it talked about numerous times today. There are social determinants of health. Sickle cell disease, anybody want to know what percentage of Americans are African American that live with sickle cell disease? I heard 80%. I heard numbers bigger. It's actually about 90%. And we know that in America, this is not an opinion, but a statement of fact. when a black person goes to a hospital, whether it's in my hometown of Atlanta or it's in Philadelphia or it's in New York City, we are treated differently. We also know that when black people go into emergency rooms seeking help for pain, they are treated very differently. So Vertex acknowledges this and acknowledges the struggles of folks living with sickle cell disease. Let's talk about it. How is it inherited? Typically, people that have sickle cell disease have parents that carry the sickle cell trait. I have a 13-year-old son that has the trait. He does not have the disease. As you see on this chart, if two parents both have the trait, there's a 1 in 4 chance that their child would have sickle cell disease. There's a 1 in 2 chance that they will have a child with sickle cell trait. That's me. And there's a 1 in 4 chance that the child will not have a sickle cell gene. When you hear people talk about genetic diseases, that means you're getting the diseases from your parents. How many people knew that there was more than one type of sickle cell disease? Yeah. There's 3 different types. I won't insult your intelligence, but some types are more severe, some types are milder. But it's like a book. You can't judge it by its cover. If someone is living with sickle cell disease, they are living with issues and challenges regardless of which form they have. About 100,000 people in the United States have sickle cell disease. 1 in every 365 black or African American babies has the disease. 1 in about 16,000 Hispanic babies have sickle cell disease. I'm 44 years old. If you were born today in America, you are screened for sickle cell disease. If you're about my age or older, you probably were not screened at birth. You found out you had the disease when symptoms showed up. But today in America, almost every child at birth is screened for this disease. What causes it? I'm not going to get too scientific, but this is important stuff to know. Red blood cells have a protein called hemoglobin, right? Hemoglobin carries oxygen to the organs and tissues in your body. Without oxygen, things go very badly. People with sickle cell disease have a mutation in their beta globin gene, HBB, that causes production of hemoglobin S. This results in some of the red blood cells going from being kind of buoyant and fluffy, as you see on the left, to more sickle-shaped, as you see on the right. You do not want your cells to be sickle-shaped because they then cannot flow through your body as freely. This was new to me. I've been in the industry 20 years, but I did not know this fact, so make sure you check this out. You are born with fetal hemoglobin. Over time, your body starts to produce what's called adult hemoglobin. The switch from fetal hemoglobin, I'm going to go back to that. The switch from fetal hemoglobin to adult hemoglobin is what impacts folks having sickle cell disease. Sickle cell disease only impacts adult hemoglobin, but if you have a mutation and you have fetal hemoglobin, you can have sickle cell disease. All right, let's talk about symptoms and the impact of the disease. This is what I alluded to earlier. In this picture, I love this picture. It's simple, but it really brings home the message. If you look at those round blood cells, that's what you want. That's what everyone wants, those healthy, fluffy, buoyant blood cells. If you look at to the right of that graphic, those sickled cells look like a crescent moon. That's not good. Where there's blockage, the organs and the tissues are not receiving enough oxygen because the cells cannot get, the cells, which the oxygen is inside the cells, cannot get to the various parts of the body. This is what causes folks living with sickle cell disease to have their number one symptom, which is pain. Pain. So the technical term is a vaso-occlusive crises, also known as VOCs. This is pain. So if you know someone that's living with sickle cell disease and they say that they're in crises, that means they're having pain. You now know they're having pain because there's vital organs in their body that cannot get enough oxygen. Okay, let's talk about pain a little bit. How do we explain it? Sickle cell disease pain can vary. People with sickle cell disease can experience pain in different parts of their bodies, in their arm, legs, chest, abdomen, lower back. Typically, there's two types of pain. Neither one is good. Acute pain. This is the sudden onset of pain. I mean, this starts very quickly out of nowhere. This is why there are people living with sickle cell disease who we call warriors, keep a bag in their home so that if they have a crisis, they can grab that bag and go to the emergency room because the pain comes on so quickly. And then there's what's known as chronic pain. Chronic pain can be daily, ongoing pain, and it can last for as many as 6 months. Neither one of these is good or bad, and then oftentimes people can have both. There's serious complications of having sickle cell disease. Fortunately, there are more treatments now so that people can live a healthier life, but this is still a very, very, very serious, nasty genetic disease. Acute chest syndrome, you can read exactly what that is, and anemia. When the number of working red blood cells carrying oxygen through the body is low, people with sickle cell disease can develop anemia. Bless you. We're going to change the battery in this slide advancer after this presentation. Oh, okay. All right. Other serious complications are enlarged spleen, and priapism. I'll let you read for yourself what priapism is. These are terrible things to have happen if you're living with really any disorder, but also with sickle cell disease. And there's other ones. These are just the main ones, right? These are the heavy hitters, but there are other complications that someone could have. Additionally, infection and organ damage. Think about it. Your kidneys, your lungs, your heart, what do they need to survive? Oxygen. What are they not getting if you have sickled cells that can't flow through your body? Oxygen. So let's talk a little bit about treatment options. I'm not a physician. I worked in healthcare for a while. Do not let anyone make healthcare decisions for you that is not a physician or part of your care team. Disclaimer over. Your healthcare team is always your primary source of information, not a pharma company, not your pastor, and I'm a person of faith, but not your pastor, a physician or your care team. That doesn't mean you can't have relationships with your pastor and with your friends and with your family, but you really should be leaning on medical professionals. And we've heard that ad nauseum from the front of the room today. Okay, so let's talk about the available treatment options. Blood transfusions. Blood transfusions deliver working red blood cells. Remember, that's the issue, right? You have red blood cells that are sickled. They're not getting to the organs. So you can have a blood transfusion to get an infusion of healthy red blood cells to help decrease those VOCs. And VOCs stand for vaso-occlusive crises, and that's a fancy word for pain. Pain, thank you. Another treatment option that is available is hydroxyurea. Hydroxyurea is an oral medication that may reduce pain crises in some people living with sickle cell disease. Pain meds are another option, a treatment option. And then the only known cure for sickle cell disease is a bone marrow transplant. That's a very invasive process. It requires you to have what's called a match and a donor. So you have to have someone that typically is in your family that is willing to be a donor for bone marrow. This is actually not accurate because there are 2 approved gene therapies on the market right now. They were both approved in December of last year. I work for one of the companies that has an approved treatment, but I won't be talking about that treatment today. There is a QR code if you want to learn more about gene therapy, what it is and what it isn't. You can click on that QR code. This is probably my favorite part of the presentation, right? Now that we have the information, what it is, what are the treatment options, what are some tips that can help you? If you're living with sickle cell disease, or if you're a caregiver for someone with sickle cell disease, do your best to help them stay connected with their care team. And really, unless you can help it, you shouldn't be going to the physician on your own. you should take someone with you that can advocate on your behalf and ask the questions. I have someone on my team who lost their father last year to another disease, and he told me, he said, Travis, my dad would ask me a million questions on the way to the doctor's office. We would get there in front of the doctor would say, what questions do you have? And my dad would say nothing. Then we would leave, and my dad would ask me a million questions. So you want to have someone there that can advocate for you, and don't be afraid, because you are paying for that doctor's time to ask your questions. Okay, that's the end of my sermon on that. Daily health practices. You want to prevent infections. I'm not even going to read the maintain a healthy lifestyle because we've covered that ad nauseum, but that's important regardless of the disease state that you're living with. And then community. Community matters. Whether you are living with a mental health disorder, whether you have cancer, whether you're living with sickle cell disease, whether you're a single parent, whether you're a parent of a child with a disability, there are people that share your journey. So find your community, find an advocacy group or people that are going through the same challenges, sometimes the same successes that you are. I'm not going to take any questions and answer because of time, but I wanted to give the group an overview of sickle cell disease. Again, I'm Travis Stevens. I work for Vertex Pharmaceuticals. I will say this really quickly before I turn it back over to either Malik or Cynthia. The team that I lead, there's 6 patient educators all throughout America. And what we did was we looked to see what cities in America have the highest incidence of sickle cell disease, and we wanted to put a patient educator in each city. So I have a lady on my team named Farah that was a nurse at Columbia Memorial Sloan Kettering. She's here in New York. I have a lady on my team that is in DC that used to work for the American Society of Hematology. I have a gentleman on my team named Errol who's in Atlanta, Georgia. I have a lady on my team in Miami, Florida. Her name is Wanda Vasquez. I have a lady on my team that's a nurse that lives in Houston, Texas. And then we just hired someone in California. And I could tell you, I work for a multi-billion-dollar company, and I'm very proud to say I think I'm the only leader in the company whose entire team is people of color. And the reason that that is important is not that only people of color can do what I'm doing, but someone said it earlier. If a patient educator is supposed to be in Miami, Atlanta, DC, New York, or California, and we're dealing with a disease that primarily impacts black and brown people, there is a level of authenticity and shared experiences when the person providing the resources looks like you. So I want to thank you all for your attention, and I'm going to turn it back over to the team.
Hello? Okay, we're back. Thank you so much. That was very informative. Thank you. All right, the moment you guys have been waiting for, I'm going to bring on my good dear friend, Mr. Malik Yoba. He is a Hollywood veteran, actor, activist, and founder of Yoba Development. Malik Yoba offers over 3 decades of a commitment to the arts with over 50 film credits and more than a dozen lead roles in network cable television series. He considers himself primarily a community and youth advocate. Born in the South Bronx and raised in Harlem, it was his, what's up Harlem? raised in Harlem, it was his debut in the Disney classic Cool Runnings, which I can also say my daughter's dad, Mr. Leon, was a part of that classic as well, so I know we've all seen it many, many times. And also his amazing performances as NYPD Detective J.C. Williams in the groundbreaking police drama, New York Undercover. That catapulted Malik into the fabric of American culture. A serial entrepreneur, the emerging real estate developer has projects in New York City and Baltimore and is currently in post-production for his educational docuseries, The Real Estate Mixtape, Volume 1, IBL, New York. Please give it up for our afternoon co-host and my friend, Mr. Malik Yoba.
What am I doing? Photos? Hold on. Look at that smile on that boy. Look at that. His teeth. Where are we looking first? All right. Good, how are you? Good to see you. You're welcome. All right. I feel like Kamala Harris right now. I feel like Kamala. We not going back. We ain't going back. We ain't going back. You better say that now. Say that word. You know I got a job to do, right? I love the love. As soon as y'all are ready, I'll get started. She taking selfies. Do you want? You trying to get a selfie?